Most people with back, butt, or piriformis and sciatica pain have been led to believe that strengthening the core will reduce their symptoms. But in most cases, it's actually not true. In fact, after reviewing over 10,000 back, butt, and sciatica pain cases, I have to give people permission to stop doing their core exercises because it's usually a waste of time and actually making them worse. Hi everyone, my name is Dr. Charlie Johnson, physical therapist, and in this video I'm going to share with you 4 signs that indicate pretty much immediately that core strengthening exercises or core work in general will not be effective at reducing your symptoms. And I wanted to create this video so you're not wasting a ton of time, energy, and money hoping and praying that you do a core exercise today, and if you just stick with it, that all of a sudden your symptoms will magically disappear. Sign number 1, if sitting up tall increases your back pain, butt pain, leg pain, numbness, tingling, tightness, sensations, whatever you want to call it, then this is a sign that core strengthening will not be effective for you, because if we're sitting up tall, we are engaging our core. And if the solution is to repetitively engage our core, but engaging our core sitting up tall makes it worse, then we can only assume and predict, and we have evidence to support that continuing to contract our core via core exercises will only make us worse. So we know that sitting unsupported in an up tall, upright, kind of perfect posture with this arch in your lower back is actually pretty darn difficult for the muscles of the spine, of the hips, especially for holding this position throughout the day. Now, it's not like we're lifting a ton of weight while we're doing this, but muscles are sort of like sponges, if you will. And muscles are filled with blood, and blood carries oxygen and nutrients. And when we are in a relaxed position, like this, well, we're not contracting the muscles barely at all. There's almost no requirements muscular-wise to sit like this. But if we're sitting up tall, like we should, which I'm giving you permission now to say you might not want to do that or you shouldn't, well, what we're doing is we're contracting the muscles at a low level, which we're kind of squeezing or wringing out the muscles. We're reducing blood supply and oxygen and nutrients to the issues that we're trying to heal if the problem is due to damage within the body. And so if sitting up tall, contracting your core makes you worse, then probably doing a lot of core exercises, contracting your core over and over again in the form of an exercise, is also probably going to be a waste of time and actually maybe keep you from healing. On the contrary, the opposite of sitting up tall and contracting the core, relaxing the core and slouching is often much more comfortable, and again is another sign that core exercise or core contraction is not going to make you feel better, because when you actually shut off or reduce the muscular requirements of your belly, of your back, of your hips, of your pelvic floor by leaning back and allowing yourself to relax and find comfort, well, that makes you feel better. So I'm going to give you permission right now that if sitting up tall makes you feel tight, makes you feel like you constantly have this tension at the end of the day the longer you sit, it's probably because you're working too hard. You're trying to sit up tall because you have a belief system that sitting up tall is good, when in actuality, it's keeping you from healing. So relax back, do something easy so you can get better faster. And if easy makes you feel better, then I don't want to do exercises which make your muscles have to work harder, because that's proven already to make you worse. The second sign that core exercises are going to be a waste of your time is if you have pain when you're in a supported sitting position like this, and or when you're lying down or sleeping at night. Why do I say that? Because there is no core strength required to sit supported, basically, and there's essentially no core activation required to sleep or to lay down. And so if you have symptoms during a time where there is no core strength required, then why would strengthening your core improve your symptoms? It wouldn't. It would be a waste of your time and it wouldn't make any sense. The third sign is if core contraction does not immediately improve your symptoms in the moment, or immediately following it does not improve your movement experience. I'll explain what I mean in a moment. But really briefly, most people have been led to believe that core exercises or any exercise or any treatment just takes time. And so people buy into working their core for 4 weeks, 6 weeks, 12 weeks in hopes that, well, it didn't work now, but if it doesn't work now, they're telling me I should just keep doing it, it will work. That's called insanity, doing the same thing over and over again, expecting a different result. If I flick the light switch here in this room and the light doesn't come on right now, it's probably not going to come on later. Exercise should be treated no differently. If we don't see an immediate change now with any treatment input, I don't have any reason or evidence to believe that it'll somehow work in the future. That's called hoping and praying. Don't buy into it. All right, so core exercises, it should affect you immediately for the better if it's something you're going to do and it's going to help you out. So what I want you to do first is pick any activity which is painful or problematic. Maybe it's bending down. Maybe it's climbing the stairs. Maybe it's, I don't know, getting up from a seated position. All right, let's just pick something that you know in your life, some pain trigger, we'll call it, an activity which increases your back, butt, or sciatica symptoms, and let's do it just one time. Now what I want you to do is I want you to brace your core as if somebody is going to kind of punch you in the gut, create stiffness, if you will, within the spine, and retest that painful trigger, that painful motion. For example, let's just say a transition for the sake of this video was painful. So I stood on up and, ooh, I feel a catch, or I have trouble straightening up. Or maybe I get a zap down my leg. Now what I want you to do is create stiffness, like someone's going to hit you in the gut. All right, create that stiffness and then stand on up. If core exercises or increasing your spinal stability or stiffness is the solution to your problem, then you should see that tightening or stiffening your core immediately causes an improvement in your ability to do an activity, in this case, making it more pain-free. All right, so find an activity, apply a core brace, contract the core, go do it. You should see an immediate change. If you don't, that reduces the likelihood that core exercises are going to help you. Now, maybe you're having trouble finding a certain activity, or maybe you're more aware of a certain motion which increases your symptoms. So let's just say that twisting is painful. Lots of people with back pain maybe have trouble twisting, or bending backwards is painful, or doing a leg raise if you have sciatica is painful. Find one motion that is painful. I call it a yucky motion. Do it just one time and get an idea of how painful or yucky or problematic it is. Then I want you to go do a core exercise. Now, I'm not going to tell you which one to do. There's many. You could do a dead bug. That's where you lay on your back and you do all sorts of funky things with your legs, but you're contracting your core. You could do something where you have a band. It's called a little pale-off press, where the band is that way and you're going in, you're going out. You could do maybe a bridge exercise or something like that, although I'd argue that's more of a glute exercise, but it does work the back side of the core, the muscles, the back straps along your spine. So let's just say for a moment that I do a dead bug. All right, so here I am, and I'm contracting us, I'm keeping it tight, and I'm doing tapping with my heels while I'm keeping my back flat. You go ahead and you do that core exercise. 3 sets until you're tired. 3 sets of 10 reps, whatever you've been told to do. Or maybe you prefer the dead bug, because Stuart McGill said you should do that, right? So you go, or not the dead bug, the bird dog, right? So you do this. Go do whatever that core exercise is. Then what I want you to do is I want you to immediately retest your yucky motion. So let's just say it was a back bend. Retest it. Is it same, better, or worse? If it's not the back bend, maybe it's the figure 4. Maybe it's a twist. Maybe it's a leg raise. Can you go higher with the leg raise? Do you have more pain-free available range of motion? You test. You find something that doesn't work that well. You snapshot how bad it is. You go do the core exercise that you've been led to believe you should be doing, that they're telling you will work. Go do it. Just one of them. Then come back and retest your yucky motion, and 1 of 3 things are going to happen. It's either going to feel better, in which case that core exercise did work, which tells me that it has the possibility to work in the future because it worked now. Now, will it? It's hard to say. But if it did work, you go do that one thing. You bottle it up. You use it as medicine. Only do that one core exercise because that's the only thing that's been tested and proven to work. And you do that daily. Maybe you do 3 sets of 10 dead bugs 3 times a day. 3 sets of 15 bird dogs 3 times a day. Pick something, a generic prescription to start. Time it before your symptoms are going to be their worst. Think about when you do the exercise too. But again, if you saw an immediate impact, test, treat, retest effect for the better, then that motion is helpful. And maybe that core exercise will work for you. That gives you evidence to believe that working the core will be helpful. If it's the same, you could try it slightly different and retest and see what happens, but it tells you that core thing, that core exercise does not work. And if you don't see an immediate improvement from a core exercise in the moment, again, I don't have any reason to believe that it might work in the future. All right? And obviously, if it makes you worse, then we definitely don't want to repeat that. All right? So that's that. Now, number 4, if you are fearful or avoidant of motion, core exercises are likely to make you worse and not be helpful. Because if you think about what core strengthening exercises or core exercises are at the core, if we boil it down, the intent of doing core exercises is to increase the stiffness or the stability of the trunk, of the back, of the tissues in the pelvic and back area. Increase the stiffness, increase the stability, not increase the mobility, not increase the motion. And so if you're fearful of motion, core exercises may reinforce your fear because it is essentially a way of trying to limit the motion in your body. It's reinforcing that too much motion or motion in general is bad. Otherwise, I wouldn't be trying to stabilize. I need more stability. I don't need more motion. And so if you're fearful of certain motions, psychologically, we know that fear and attention and avoidance fuel problems, meaning fuel pain in this case. Because the longer you avoid something, the more you reinforce it's bad. And if you're here bracing your core, reinforcing to your mind that I need to protect and I need to guard, then you are reinforcing that there's a problem, something that needs to be protected. And you are further reinforcing your fear of motion because you're trying to consciously limit it by contracting your belly through these different exercises. Okay? So, there we have it. If sitting up tall, contracting the belly makes you feel worse, that's a sign that contracting your belly via exercises will continue to make you worse. Slouching often makes people feel better. You have permission to slouch if that works for you. The second thing, pain while sitting or lying down, because sitting or lying down requires no muscular effort, no core contraction, essentially. And so why would I need to strengthen my core to reduce pain during an activity where I'm not even using my core? Doesn't make much sense. Third thing, core contraction does not relieve your pain during an activity or upon test, treat, retest. It does not improve one of your yucky, painful motions. Doesn't give us any evidence to believe that it'll somehow work in the future if it doesn't work now. And then finally, if you're fearful of movement, contracting the core or limiting movement reinforces that movement is bad, mentally and physically. All right, so hopefully it was helpful. Let me know your thoughts. Are you going down the path of constantly contracting your core or doing core exercises, but you're not getting much better? Or it works temporarily, but the problem comes back? Could you be reinforcing the problem psychologically? Could you be actually causing more contraction within your core, reducing the blood supply, the oxygen and the nutrients, and making healing harder than it has to be? Let me know your experience with core exercise below. And if you're interested in learning how to solve this problem naturally, back, butt, and sciatica problems, just click to watch many of my other videos. Thanks so much. Chat soon.